Hello and welcome to Cardiology 101. This is Dr. Peg, and today we are going to learn about ventricular hypertrophy. So when we talk about hypertrophy, it means increase of muscle size of ventricles. So it can either be right ventricular hypertrophy or left ventricular hypertrophy. So imagine this, if a group of muscle is working against something, for example, any resistance, the size of that muscles increases. For example, this is something that you see in gyms when we train our muscles. So similarly, when there is some extra load on ventricles, for example, in the case of hypertension, systemic hypertension, there is increase in the afterload on the left ventricle. So what happens is left ventricle increase its size. Right. It can also be seen in aortic stenosis, for example. It's the same thing because we are increasing the resistance against which left ventricle is pumping its blood. So left ventricle increase in its size to compensate for this excessive need of energy that is required of left ventricle. So in the case of right ventricle, we know that the right ventricle empties its blood into the pulmonary system, right? So if there is increase in the resistance in the pulmonary system, for example, in pulmonary hypertension, we will see that the right ventricle has increased its size, right? And if there is pulmonary stenosis, pulmonary valve has stenosis for some reason or the other, or if there is a backflow, pulmonary regurgitation, for example, we will also see the same thing. The right ventricle will increase its size. So the question is, how do we identify right or left ventricle on ECG paper? I would like to bring forward something that we have discussed so many times in our previous sessions. It's that the R wave in the precordial leads. For example, in V1 to V6, we see that the R wave gradually increases its size until it reaches V6, where it is at its maximum amplitude, right? The R wave shows the mass of left ventricle. So we know that the lead V1 is placed on the right side of the chest, and as we move towards the left, we get V2, V3, V4, V5, and V6 to a point that V6 is directly at the top of left ventricle. That's why V6 has the highest or the largest amount of the R wave, okay? So keeping in mind that concept of R wave, we know that the R wave should be maximum in V6 and it should be minimum in V1, right? That's something that we can look for in ECGs when we are talking about ventricular hypertrophies. All right, so let's just go through the different criterias of these things. So first up, we have the criteria for left ventricular hypertrophy. So we discussed that the R wave is the more important wave that we see in left ventricular hypertrophy. So the R wave in V5 to V6 should be more than 25 mm or 5 large blocks, because each large block has 5 small blocks. So 25 mm or 25 small blocks or 5 large blocks. So I would like you to imagine what's the opposite of R wave. It's S wave, right? So if we are looking for R wave in V5 and V6, we should be looking for the S wave in the V1 and V2, because it's the opposite of that. So S wave in V1 or V2, if it's more than 5 large blocks or 25 small blocks or 25 mm, we would say that it has left ventricular hypertrophy. So let's just go back for a moment to the session where we discussed about the axis. So we said axis is something which shows where the electrical activity of heart is directed at. Normally it is directed towards the apex, but we see in left ventricular hypertrophy that the left ventricle has increased its mass. That's why we see the shift of electrical activity towards the left side. It's common that we see in left ventricular hypertrophy that our axis is deviated towards the left side. So it's also a clue for us. If we get left-sided axis, we should definitely look for our left ventricular hypertrophy, right? So for example, if we cannot see an S wave in V1 or V2 or R wave in V5 or V6, that's individually fulfilling the criteria. What we should do is we should add V1 with V5. The S wave in V1 should be added to R wave in V5, and S wave in V2 should be added to R wave in V6. If the sum of these two is more than 35 mm, right, or 7 large blocks, we should say that left ventricular hypertrophy is present. You should take a screenshot of this slide so that you can always come back to it and revise it. All right. let us just look at some examples of left ventricular hypertrophy. So we discussed that the R wave in V5 or V6 shows the left ventricular mass, right? So if we look at R wave, it's quite huge, right? So if we start counting from here, one large block, two large block, three large block, 4, 5, and 6. So individually, R wave in V5 is fulfilling the criteria of left ventricular hypertrophy, right? So this patient has left ventricular hypertrophy, but there is something amazing that I would like you to look at. For example, as we see that the amplitude of R wave is increased, we also see that there is T wave inversion, right? You see small depression of ST segment and then there is T wave inversion, right? So the T wave inversion in this picture shows that there is a stress on left ventricle. It is not ischemic, but it shows that there is some stress. This pattern is repeated in many ECGs and I will discuss them as we go through them. But this is something that you should be looking for. If you see this picture in V5 and V6 and one in AVL, you should say that left ventricle is in some sort of strain, even though the R wave is not fulfilling the criteria of left ventricular hypertrophy. So for example, in clinical hypertension, where hypertension is not controlled properly, we will see that even though the left ventricle hasn't increased in size and hypertrophied strictly, but we will see this pattern there, and this will tell us that the left ventricles are in strain. All right, let's look at the next picture. Okay, so if we look at this ECG, the right now what I am looking is, if you look at for example lead 1 and lead AVF, can anybody tell me what's the axis here? It's left-sided axis deviation, right? So this is our first clue towards left ventricular hypertrophy. So next up, we should look at the S wave in V2. So if you look at the S wave in V2, it's quite deep. Rather, it is covering almost 8 to 9 large blocks. So individually, this S wave in V2 is telling us that there is left ventricular hypertrophy. And also, if you look at here in V6 and V5, you will again see that pattern of ST segment depression and T wave inversion. So this is left ventricular strain pattern that is revising here. Again, you can see it V5, V6, 1 and AVL. So because 1 and AVL are left high lateral leads, right? So there is hypertrophy up till that point. I hope you understand what we just discussed, but if you have any question, please write it down. I will be happy to answer them. Okay, so what we have now, so if you look at this ECG, we do not see any axis deviation. So this shouldn't confuse you, right? Because we can see axis deviation, but sometimes we don't see it. Most of the times we will see there is axis deviation, but sometimes we won't see it. But our main point to ponder or main point to focus on should be our R wave or the S wave in V2 or V5. So if we see here in V2, right? So there is very deep S wave, almost 11 large blocks. So this is telling us that there is left ventricular hypertrophy. Another point for us to note here is you see the same ST segment depression and T wave inversion pattern here, ST segment depression and T wave inversion there in 1 and AVL as well. So this is our left ventricular strain pattern in the presence of left ventricular hypertrophy. Right. So next up we have a right ventricular hypertrophy, and the criteria for it is we will see our right axis deviation at this point. So we will have right axis deviation. Our axis would be shifted towards the right side because the right ventricle has increased in its size, right? We will see a dominant R wave in V1, which should be more than 7 small blocks tall, and it should be higher than the S wave. The ratio should be more than 1. Or we should look at the dominant S wave in V6. I understand that this must be confusing for you at this point, but remember the lead V1 is at the top of right ventricle. It's on the right side, right? So as we discussed, the R wave shows the ventricular mass. So V1, normally in V1, do we see R wave? No, we don't. We actually see R wave more prominently in lead V4 to V6. But if we see a dominant R wave in V1, that should tell us that this is right ventricular hypertrophy in some way, right? And V1 should be more than 7 small blocks, not large blocks. I'm talking about small blocks, 7 small blocks. or dominant S wave in V6 more than 7 mm deep or 7 small blocks deep, right? And right ventricular strain pattern, it's the same as left ventricular strain pattern. Difference is you do not see the ST segment depression, T wave inversion, V5, V6, A1 and AVL. Rather you see them in V1 to V3 or V4. You can also see it in 3 and AVF, right? So that's the same pattern, but we see it in different leads, and it's called right ventricular strain pattern. All right. So if we look at here in V1, let me just get the highlighter. Okay. Lead 1 is pointed more towards the downside, right? And AVF is pointed more towards upside. So it means this is right axis deviation. And here you see the actual picture in V1 and V2. Should you be seeing this R wave so dominant there? No, you shouldn't. And it means that there is right ventricular hypertrophy right there. And in V2 you can also see the picture, same picture. In V3 you can see the same picture, and you also see the strain pattern there, the ST segment depression and T wave inversion throughout V4, right? Let's look at another example. Again, if you see it V1, lead 1 and lead AVF, you should conclude that the axis is pointed towards the right side, right? So if you look at V1 here, right? So you can see that it has small Q wave, then it has upgoing R wave that's bigger than 7 small blocks. So this ECG is showing that this patient has right ventricular hypertrophy. You can see the same thing in V2. And there are a couple of other things that are going on in this ECG. If you can point that out, please comment it down. I will be happy to see how many people have got it right. And you can see that there's again that strain pattern going on here, here, and again you can see it in 3 and AVF as we discussed before. So this is our right ventricular hypertrophy. Do we have another example? Okay, so we have another example of right ventricular hypertrophy. If you look at lead 1 here and lead AVF here, it shows that the axis is pointed towards the right side, and we see the same pattern of strain on the right ventricle. Why it's happening so? Because there is right ventricular hypertrophy. So it's more than 15 small blocks, so it should be right ventricular hypertrophy, and you see the same strain pattern here and here. Well, thank you so much for tuning in today. I hope you learned a lot from this session. And if you haven't subscribed to this channel, please do. I will try to be more punctual about the way I upload my videos, but it's been quite a while since we last had our session. I will see you in the next session. Take care.